We got a good show today. I'm excited. Here in Woodland Hills, California. BrightStar PT, physical therapy. That's BrightStarPT.com. And we've got the founders in studio with us, founding partners, Masha Katz, yes indeed, and Savina.
Hello.
How are you?
Very good. Very excited to be here.
Yeah, first of all, thank you for being here. I know you drove a long ways to get here.
Our pleasure.
All the way
around that
upstairs.
That's right.
It's about time, right?
Mm-hmm.
Anyhow, thanks for being here. I'm excited to talk to you about a whole lot of stuff related to physical therapy.
We're ready.
Let's go.
Well, anyhow, yeah, you guys are awesome. You guys are coming back down here, and I mean, we talked a little bit about obviously physical therapy, the importance of it. We have a resident orthopedic surgeon that joins the show frequently for the last 20 years.
They know Dr. Lee very well.
Yeah, yes. And we're always talking about ailments and injuries and recovery, and a lot of it has to do with physical therapy.
Yes.
I think it's really important just because a lot of people are trying to avoid, especially surgery these days. And so you guys are the experts.
Right.
I mean, Masha, you've been doing this for a long time as well. And how long have you guys been partners, actually? Since the get-go or no?
Yeah, since the get-go.
That's how it all came about.
Wow.
Yeah.
Between the two of them, it's almost 40 years of
right.
experience.
Masha.
That's true.
Yeah.
But, yeah, we've been together for the last 15 years.
Wow. So, first of all, 3 locations, Valley Village, North Hollywood, Woodland Hills, and Beverly Hills.
Yes.
Actually, Woodland
Valley
Hills.
Village and North Hollywood are together.
Yeah.
And then Woodland Hills and Beverly
Valley,
Hills.
yeah.
Yes. So 3. Yes, you're right.
It's like a triangle that you can't miss.
Yeah.
You really shouldn't miss.
So we really are covering the entire Los Angeles area here. There really is no reason to go anywhere else but us.
There you go.
The way I look at it.
And it's interesting because you deal with adults, you deal with children of all ages,
Yes.
perhaps even newborns. I mean,
all the time.
Absolutely.
So what are some of the things that you guys have seen, I mean, when it comes to actual newborns, I mean, and that stage of life, let's just say, because that's of interest to me.
It is. So with newborns, we have several issues. First of all, because of the Back to Sleep program that started in 1984, there has been an increase in problems with the shape of the heads of the babies. Nowadays, they have to wear helmets by 86% since the Back to Sleep program. And so that before was never an issue, and now we have problems with the head shape and the neck. And so we specialize in this. I dare say that we're probably the best in our field of specialty in the Los Angeles area. And what we do is, if the babies come early on, and I have to say that we're getting more and more early referrals, we eliminate the chances for them to get helmets.
Wow.
I want to say by 95%.
At least.
The only time when we send for helmets is when they come at the very end of the opportunity to get a helmet and the head is very misformed, and then it's out of our hands.
Interesting.
So if they come to us, also babies that just are perfectly healthy with everything else, and they are delayed in being able to roll or to sit. So we provide very good, very helpful guidance to everybody. And obviously a lot of cases of just some serious cases like cerebral palsy, Down syndrome, and such.
Wow.
Feeding issues, we specialize, and again, we're very, very good at that. So any baby that has issues with feeding, drinking milk, all of that, very, very specific issues that we help with.
Didn't even
Jeez.
know.
Did you even know?
No, I had no idea.
I know one child who is perfectly healthy, thank God, but he can't wait to put a helmet on.
Yeah, my son. Yeah, his football helmet. Yeah.
Not that kind of helmet.
Yeah, seriously.
That's your department.
Yeah. So you guys cover a lot of different areas. You obviously talk a little bit about pediatric care. We can talk about occupational therapy and so forth. But talk a little bit about some of the common methods that you guys really specialize in, especially when you're seeing like the everyday Joe or someone who's coming in. What's like the most common issue that you're seeing from your clients over the Over the since 2004, since you started.
That's
Since
right.
2004, that's right.
Did the math.
Wow.
We're going to date ourselves here.
I'm sure you see a lot of people that were in automobile accidents. I'm looking
Yeah.
at you,
We-
I'm
we
looking
see
at you,
some-
Masha.
Yeah,
Right.
yeah. It happens.
Yeah, it
To the
happens.
best of us. Yeah, we see people all kinds of, average Joe type of injuries, whether it's from automobile accidents or, tripping at home over your cat or weekend warriors or
Yeah.
or what recovering from surgeries, recovering from skiing and
There you
whatever. We see a lot of back injuries. I mean, I think probably one of the most profound.
Back and neck, absolutely.
Yeah, probably one of the most profound injuries that I think everybody experiences sometime in their lifetime.
I mean, so many
In
people
this
sit
back
in front
pain.
of a computer like 6
Yeah. That's
hours
right.
a day, and
That's right. Back, neck, hips, something starts to give.
I can
Something
use a
starts to hurt.
massage, and a place that I want to go for a massage is right upstairs in your office
There you
here
go.
in Woodland Hills.
Yeah, and a massage can take care of a lot of problems. You would be surprised, and a lot of the physical therapy offices are just not willing to do it. You go to physical therapy offices these days, they put you on electrical stimulation and on a hot pack.
And
that
then on
just
a
doesn't-
bicycle.
It's not enough.
Right. No, we do actually a lot of one-on-one patient care, a lot of manual therapy. Massage is just one part of it. We do all these other things such as electrical stimulation and cold laser and ultrasound. But I think one-on-one attention to our patients and really not avoiding or actually avoiding the cookie cutter approach is what separates us from most other places.
We touched on scoliosis last month, and we talked with you. That's a common, unnatural, too bad being born with it problem. But
Yeah.
you have some kind of therapy for those patients as well.
Yes, we have a very, very good specialized therapy for patients with scoliosis, for children and adults and even infants, actually. There is such thing as infantile scoliosis. Most scoliosis people that we think of, these are people, or actually kids, diagnosed with scoliosis about 9, 10, 11, 12 years of age. And we use very particular methodology to treat them. It's called Schroth, came from Germany about 150 years ago, and there are very few specialists in California that specialize in it, and we're proud to say that we are one of them.
And Masha is the best. I have to say that. I do have to say something about scoliosis that we want to mention, and it just happened yesterday. We had a patient, and they went to their surgeons, the scoliosis surgeons, and sometimes the surgeons say, and they don't know about physical therapy and the Schroth method, and they say, you know what, there's nothing you can do. If it gets very bad, that what we'll do is we'll fuse your spine. And so the parents really are left with no choice. They sometimes go on our website and find out about Schroth therapy.
And that website,
BrightStarPT.com. So that's where they find more information. But many of these kids, many of these parents are not given with anything else, any other hope, except for surgery. So they're told, you know what, wait, if it gets worse, you're going to do surgery. If not, you just sit and wait, and that's it. And when they come to our offices, I have to tell you, because Masha is our specialist, that she just does has incredible success with these cases. They get better, they have hope, and it's just we want to put the word out there that there is hope, there is treatment, and everybody that has scoliosis should come and try it.
Yeah, I mean, obviously, it's a pretty crazy surgery that I've heard through the
Oh, my
grapevine,
goodness.
and yeah, I mean, I believe it or not, you can
Martha
do.
and the Vandellas.
Yeah, that too. But you can certainly look at the numbers. I mean, a lot of people actually suffer from scoliosis, different degrees and so forth. But it's pretty debilitating because, I mean, people just can't do their everyday work. I mean, I've seen my wife who struggles to. She gets home, she's like, can't really do anything. So I'm stuck doing everything. But, it is what it is. But till death do us part, ladies. Yeah.
The very special specialist, Masha Katz, and our official Los Angeles physical therapy providers. They're here in studio with us. You can catch them on Instagram, Facebook, their Twitter. The very ever-present Jared, their IT guy, is always
Hi, Jared.
making it right.
He's wearing like 10
Hi,
hats.
Garrett.
hands down the best. Visit BrightStar and
You're
Do it
always
right away.
welcome.
You know, we when we have them back in, we're going to talk a little bit about even sports injuries too. I think it's a big deal.
Absolutely.
Got a lot of athletes who listen to the show.
And
We have a lot of athletes who join the show.
and a lot of kids in the youthful leagues.
Yeah,
Yeah,
absolutely.
we can talk about
Soccer.
kids and sports specifically.
There you
We can
go.
do
That'd be an
kind of a
interesting
segment on that.
conversation, right?
Kids and sports, absolutely.
BrightStarPT.com, hands down, the best.
Thank you.
Especially since
Thank
we
you.
can literally not even use an elevator. You can go up the stairs here, Pop. Get a massage. By the way, real quick before we go to break,
Yep.
massages are available too. You can come
Absolutely.
in.
Available.
Massages are available, Pilates are available, and for everything else, we offer free consultations.
Very good. Very good. BrightStarPT.com. More to come this morning. I'm excited. So much to cover. Stay tuned, everyone. We'll be right back.
Thank you.
Ladies, you're the best.
Thank you.
What am I supposed to do when the best part of me was always you? And what am I supposed to say when I'm all choked up that you're okay? I'm falling to pieces, yeah. I'm falling to pieces. They say bad things happen for a reason.